Good afternoon, everyone, and I'm excited to present Salivate, a novel saliva-based diagnostic chewing up for early detection of diabetic foot ulcers. So let's begin with the problem. India faces a significant diabetic burden. According to the rule of 15s, 15% of diabetic patients develop foot ulcers and 15% of those face limb amputation. This isn't just a health issue. It impacts productivity, emotional well-being, and national economics. But what if we could catch it early, before even the wounds form? Our solution is simple, cost-effective, and scalable. A chewing gum that changes color when markers for diabetic foot ulcers are detected in saliva. Studies show that CRP, IL-6, tumor necrosis factor alpha, and MMP8 rise 6 to 12 hours before even the symptoms appear. We plan to leverage these biomarkers for pre-symptomatic detection. This is a working area where the patient chews gum and the color changes, and he inputs the color change into the app. So coming to the working principle, we embed gold nanoparticles conjugated with specific antibodies to the gum. When the patient chews, saliva interacts with the gum. If the biomarkers are present, the gold particles aggregate, changing the gum's color. This color shift from red to purple to blue serves as a visual warning, prompting the user to seek care. These are the relevant data and values, and this is the colorimetric change. Okay, and our system uses the monoclonal antibodies and monoclonal antibodies against CRP, IL-6, TNF alpha. And this is the antibody sensitivity and chemistry. So we can see that we can detect we can detect these markers in the saliva at a very low concentrations too. And Coming to the color, these are the estimated colorimetric changes, and these are the estimated colorimetric changes in the gum. And coming to the composition and design, our gum has three layers basically. This is the composition. Uh, the three layers of gum include first base matrix, which is chewable, saliva activated, and non-reactive. And coming to the detection goal, this includes gold nanoparticle antibody conjugates and stabilizers for them. And the microencapsulation matrix, this protects the active ingredients and releases them only upon chewing. All these components are generally recognized as safe and are designed for rapid detection within 2 to 5 minutes. This is a clinical workflow where the patient goes to the nearest health center, or he administers he chews the gum by himself, and he reads the result, and he categorizes himself under the risk category, and he communicates with either Diabin or a personalized healthcare companion app, or the nearest ASHA worker to get educated regarding his risk status and follow up by the app or ASHA worker. And coming to the scalability, the scalability or on scale or production costs are low. Each gum can be manufactured under 50 rupees, making it even affordable for the masses. We plan to partner with the pharma manufacturers and distribute through PHC, CSR programs, and religious and cultural outreach networks. So these are the resources which we require for making this gum. And yeah, this is the approximate pricing which we expect per unit. And the challenges which we are aware of currently are cross-reactivity, and these biomarkers are also implicated in the conditions like periodontitis and oral cancer. That's why we propose a secondary clinical setup post the positive gum test, conducted by PHC staff, and ensuring accurate diagnosis and follow-up. So basically, these markers can be used to detect oral cancer, periodontitis, and diabetic retinopathy too. So this means we are basically getting a signal that the patient is going to be infected with going to suffer from either of these, and the patient can and the doctor can test for all the three too immediately after he realizes that he is at risk. And the stakeholders are patients with diabetes, doctors and caregivers, frontline health workers, government and insurers. And our buying strategy includes leverages India's cultural networks by integrating religion, language, and community leaders, plus the Diamond app. We plan to build on trust and adherence. So our vision for the future is this. In phase one, we are going to do a pilot study in two states. Either if we think of Tamil Nadu right now, and we cover 1 lakh patients, and we collect the biomarker data and outcome data. And in phase two, we are planning to expand to 1 million beneficiaries and integrate Diavin app usage along with it. And in phase three, we are going to integrate with this with Ayushman Bharat Digital Health Mission. And coming to the conclusion, salivate isn't just a product; it's a paradigm shift in early diabetes care. Simple, non-invasive, scalable, and empowering. We are not just detecting disease; we are winning time for the patient, we are winning trust for the system, and we are winning lives with salivate. Thank you. Yeah, and continuing with Diavin. I'm here. So Diavin is our integrated digital health solution aimed at preventing diabetic foot ulcers by turning behavior into medicine through lifestyle change, personalized coaching, and culturally tailored motivation. So the problem we've seen that diabetic foot ulcers aren't just caused by sugar levels; they are worsened by addictions, stress, poor hygiene, and bad diet. These are modifiable, but only if the patient is educated, engaged, and emotionally invested. Sadly, most patients lack support, motivation, or clarity on how to change their behavior. Diavin is our answer. A hybrid digital health ecosystem that combines gamified mobile app that drives lifestyle change and the salivate gum to provide real-time biomarker-based alerts. Together, they offer personalized nudges, behavioral tracking, and clinical backup. Coming to the features and technical feasibility, let me walk you through the app's modular ecosystem. User risk stratification based on input data like age, sugar levels, and habits. Lifestyle tracker, which logs diet, activity, medication, and gamification engine, which rewards the users for small victories, and AI-powered motivational coach uses GPT-based open source models to speak to the user in their own language and in the voice of someone they care about. So they get motivated easily. And we are going to give them cost saving insights. For example, let us assume the patient meditates every day, and by meditating, his glycemic index is going to get under control, and his glucose levels are going to get in under control. By this, he is going to save. Uh, 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 like we are going to give him the insight that he is going to save some 500 rupees in the next 1 year by doing this, by following this behavior. Yeah, thus enhancing the positive feedback loop. And coming to the health education, we are going to give them micro lessons in the language which they prefer, and we are going to help them assess their own diabetic state. And we are going to integrate with salivate, which interprets the gum results and suggests the next steps too. This is the basic clinical basic outflow where the patient enters his details in the first thing, and he performs daily tasks. And by this, he's given financial motivation by maintaining this healthier lifestyle. You are going to save this much amount on healthcare costs, and we are going to introduce the community-based motivation too, where he can look at others' progress too and how much others are saving too, motivating him to follow the healthcare and lifestyle changes. And we are going to give them daily tasks too, where he is asked for has to do brisk walks, breathing exercises, and etc. And there is going to be a lifestyle tracker. There is going to be regular alerts when the patient is at high risk to develop diabetic foot ulcer. He is asked to chew the salivate gum, and then the risk is assessed. And if this whenever the app recognizes that there is a high risk for patient developing ulcers, it immediately notifies the doctor nearby. And the clinical workflow. The clinical workflow includes diagnosis of diabetes, installation of app, and fill the data about the demographics and app permissions, daily monitoring of activity, salivate test results updated in the app. In high risk cases, the app notifies the nearest healthcare center or the patient about the risk and helps it mitigate as soon as possible. Coming to the cost associated, we are estimating the cost to form a minimum viable product at around 28 to 30K. And limitations and mitigation strategies are basically the users have mistrust of do it yourself and healthcare digital tools. So by partnering with Ashas for initial trust establishment, we can mitigate this, and we can use. Then there is another limitation that there is low digital literacy. So we can simplify this by using a simplified UI, regional language integration, and voice-based alerts. These are the target populations and buying strategies. And the buying strategies, I have another buying strategy which is very peculiar to India. So we know that India is a culturally diverse, and so culturally diverse. So dialect speaks in your language and your in your belief system. For example, let us assume a Hindu user may be guided by Lord Krishna. Like the user interface is guided as a guardian angel or Lord Krishna, and it offers encouragement with Bhagavad Gita verses. And the Christian users might be inspired by guardian angel sharing lines like your body is a temple and etc. This makes the experience deeply personal, relatable, and sticky, improving the adherence of the patient. And we have a pilot vision where we, we 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 work on building trust and test the system in real life. We propose a pilot within the government offices where we can track app engagement, gather feedback, fine tune the product before full rollout, and this sets the stage for integration into state health programs and even Ayushman Bharat digital health mission in the long run. So these are the sigma and social nuances associated with this. And coming to the bigger picture, Davin isn't just an app. It's a daily motivator, a digital health companion, and a public health strategy. Combines the power of AI, behavioral science, diagnostics, and culture to make a user participant in their own healing. In short, Diavin helps users understand their disease, stay on track, avoid diabetic foot ulcers, and save long-term health costs. Let's just not manage diabetes. Let's win against it. With Diavin, and thank you. This is Team 28 signing off.